Well, an Eastern Cape doctor is causing a stir for all the right reasons. Not only is he promoting COVID-19 vaccines, he's also getting loads of attention for the pic he posted on social media when he got his jab. I'll tell you more about that a little later, but first the important stuff. Of course, South Africa is seeing a decline in people showing up for vaccinations. Some experts say it's hesitancy. Others say the jabs aren't easily accessible. Let's talk to Dr. Adam Woodford. He works at the Livingston Hospital in Gqeberha. He joins us now live to talk more about these issues. So, Doctor, thanks for your time. We appreciate it. Let's start with the serious stuff, right? We've seen these anti-vax messages doing the rounds. We've seen people not showing up for vaccines. But you have put a positive spin to this by encouraging people to go out there and get vaccinated. Tell us why you did this.
Absolutely. It's been pretty disappointing to see the level of misinformation that's being spread out there, whether it's in the workplace, personal spaces, or all over social media. And I felt compelled that we need to do the same. And sometimes people need to see it coming from us. And that's why I took social media to do that. And like I say, while I always respect people's opinions, we must discern the difference between talking opinions and talking facts and lies. So, for example, when me and my wife watch the Notebook movie, she may say that that movie was only okay, and I disagree with her and say it's the best movie I've ever seen. That's our opinions. It's fine. We'll move on. But if someone tells you that the Earth is flat, that's just blatantly a lie. We have copious amounts of evidence to say that the Earth is in fact round. But that's harmless. You can believe that the Earth is flat. It's not going to be a problem because it's not like you're going to walk to the edge of the Earth and just fall off into the cosmos and die. But when you are spreading misinformation and that the vaccine doesn't work, then that does have consequences. And I think we need to own our actions of what we say, what we promote. Because if I promote that the vaccines are dangerous and they're going to kill you, someone's going to believe me, not get vaccinated and have a chance of dying from COVID. So those are the actions we have to take responsibility for.
Yeah, and of course, as a healthcare worker, it's important for you to get vaccinated to protect yourself and, of course, those patients who you work with. In your particular hospital, what has been the response to the vaccine? Because even some healthcare workers are hesitant, aren't they?
Yeah, they make a very small percentage. But I think all of my colleagues that I know and through the various departments I've worked, we've all just got that vaccine from day one. We've seen what it's done in the first wave when we didn't have it, and we lost a lot of colleagues. A lot of people got sick. And one of the other things people don't realize is when COVID does a clean sweep among staff, you have to shut down that department for a while. And that results in not being able to give care for whatever discipline that may be. So it was most important to protect us, but also to carry on giving a service that needs to be given. And when that vaccine came, after what we've been through, we've been physically, emotionally exhausted beyond recognition that this vaccine provided us so much hope going forward for South Africa and for the world.
Yeah, that's really good to hear. So what's your message to South Africans who are on the fence or just haven't had the time to go and get the vaccine?
Yeah, so while I say to some people, I can understand vaccine hesitancy in the beginning, but we've got mountains of evidence collectively across all different countries all over the world that is telling us that it's exceedingly safe. Whereas some people are saying, you can get anaphylaxis, you're more likely to get an anaphylaxis from a peanut. So, those kind of risks are very, very, very small. And the side effects are immediate, basically. It's quite soon after the vaccine. So for anaphylaxis, by the time you leave the vaccination center, you're basically in the clear. So they do checks and things like that. And the vaccine's effective. It's showing over multiple countries, even for the Delta virus, depending on which vaccine you get, and obviously different subgroups amongst the patients. So it's protective over 95%. So you're looking at the death group. So people misinterpret the statistics. when you're measuring the efficacy, you're looking at the outcome. So you're looking at the deaths. And now all the COVID deaths we had, we could have reduced that by 95% if we had the vaccine from the get-go.
All right, let's lighten things up a bit, Doc. You've now become known as Dr. McDreamy after you posted your picture of you getting the vaccine. Let's try and get that picture up. I think we have it, just for those who haven't seen it. So this doctor actually managed to make waves because of this picture, and he became known as Dr. McDreamy, etc. How have you been handling all that attention?
It was quite surreal. It was hilarious. There was actually a lot of attention, but it was, I guess, for the right reasons. So, I didn't know I was going to get the vaccine that day. So otherwise I would have wore a shirt. Everyone thought I wore a shirt just to show off some muscle. But yeah, I'm glad it got out there to just show, that it has my vote of confidence, it has my colleagues' vote of confidence, and that was when vaccines enrolled in South Africa. Basically, we were the first to get it, and to lead the way, to show everyone that that's the way we're going forward. But yeah, it was crazy. It was a lot of attention, but it's died down now.
Well, it's going to reignite now. Thank you so much for your time. Keep up the good work. We appreciate it. He clearly works out. Dr. Adam Woodford. We'll have more